Hey everyone, welcome back to my channel. My name is Nana. I'm the locked nurse. If you have never been here before onto my channel, I pretty much talk about the career of nursing, things that involve nursing or nurse practitioner. And I also talk about hair, natural hair and locks, and also a smattering of other things in between. Anything in lifestyle, which should include all of you. So, if any of those things interest you, go ahead and hit that subscribe button because you don't want to miss any more of my videos. Hit the notification bell also so that you know when I post something new. Today, I wanted to talk a little bit about all the things that you can do with your bachelor's or associates in nursing that are not at the bedside. So in the past 2 years, I can't even begin to think of how many nurses have left the bedside because of COVID and because of the intense burnout that COVID brought us bedside nurses. So many people have left the bedside, and even if it's not COVID related and you just, you're a new nurse or you're an old nurse, it doesn't really matter. You really realize that being at the bedside is just not doing it for you. Maybe it used to do it for you, but it's not doing it for you anymore. If you're a new nurse, you've finally come into, your own and nursing, you're doing your own thing at the bedside, and you've realized, what did I do? This bedside nursing is different, and I don't think that it's for me, and it's okay. The bedside nursing is not for everybody, and this video is basically to tell us all that have felt so many times like bedside nursing was not for them, that there are many other things that you could be doing rather than bedside nursing. So let's go ahead and get all this information in. So the first thing I'm going to say is that I think that it's really important for whatever it is, wherever stage you're at, but I think it's really, really important to spend some time in the hospital. Just because the hospital is just a very good way, and the bedside is a very good way of acquiring some basic skills like IVs and phlebotomy and operating IV pumps and administering medications and drips and all this other stuff. Working on a med-surg floor is like the best place to really, really get those skills down. And then also just kind of like your communication skills, your time management skills, organization skills, and critical thinking skills. All of that stuff is very, very important. You can take that and use that anywhere else that you're going to be working if you decide to leave the bedside. And I feel like those things are very easily worked on and easily acquired at the bedside. And so even if you do just 6 months at the bedside, you will get some of those skills down really well, and have those skills whenever you leave the bedside. First thing that I want to talk about, the first avenue that you could take if you don't want to do bedside, is clinic nursing. And that's where you would work in a doctor's clinic and or doctor's office, I'm sorry. And those are obviously a little bit more normal hours, like the more 9 to 5 kind of hours, and not the 12-hour shifts that we usually do in the hospital, if that's something that is too much for you. And usually what nurses bachelor's prepared, I don't know what the options are for associates prepared nurses, because really they're trying to move all of us to at least bachelor's prepared. So if you have your associates, I would highly, highly, highly encourage you to go ahead and get your bachelor's, because you will have way more options out there. But anyway, back to the clinic. So what you would be doing there as a nurse would be, you'd be kind of getting histories and updates from patients. You'd be coordinating the care plans and things with the doctor, and you'd administer some medications. Kind of like a lot of the things that we kind of do at the bedside. You probably throw in some IVs and get some blood maybe, or maybe they have a phlebotomist. Kind of some of the things that we do at the bedside, but not in that setting, in more of the clinic setting, which is way less acute. Patients are way less sicker, and the hours are way more quote unquote normal, the 9 to 5s, and so if you kind of like those kinds of like clinical things that we do in the hospital, but you don't want to be at the bedside, clinic nursing is probably something that you should really think about. The second option that I want to talk about is case management. Now, case managers are very, very important because they kind of work with patients that have left the hospital and that are at home after having a number of things like surgery, or they had some sort of injury that they were in the hospital for. Case managers work to keep the patients at home and not having to come back into the hospital. So because rehospitalization costs hospital a lot of money, so case managers kind of like coordinate the care, make long-term plans for the patients, teach the patients about treatment options, and also they provide emotional support for the patients because they're the ones that see them at home, like in their what if you call the natural habitat. And so they are very, very, very important because they kind of give the patients a good transition back home after whatever it is they experience in the hospital, and keep patients healthy as possible, so they don't have to come back to the hospital for whatever. The third option that I wanted to talk about is being an OR nurse. Now, these nurses work in the hospital. Obviously, they work in the operating room. They help kind of prep the patient on the pre-op, and then they are also in there assisting the surgeons with the surgery, and then they're also there at the end of the surgery in the post-op area, where a lot of patients get extubated and do all this stuff, and kind of get them ready to go back either to the ICU or to the floor or wherever it is that they need to go. This position is very kind of like high turnover. You don't really get to spend all that much time with one patient. They come in, you prep them, we do surgery on them, you send them off to the floor or wherever they need to go, and that's it. And I believe this has semi workable hours. Like their shifts are not quite as long as 12-hour shifts that we work on the floor, and a lot of times you don't have to deal. There isn't all that much time to deeply connect with patients, and they're knocked out half the time anyway. So if that's something that's hard for you, you won't have to do that. You may have to talk to a few family members, but it's definitely not like being at the bedside. So if the OR is something that interests you, this is definitely something to think about. And also just kind of like the quick run through with the patients. If that's something that sounds good to you, definitely consider OR nursing. The fourth option that I wanted to talk about is home health. Now, home health is huge because this is where if the patient is needing continuing care, obviously they're not sick enough to be in the hospital, but they need help at home. They need continuing care. They need help with their medicines, or with any number of other things. Home health nurses are the way to go. Are the ones that are getting to do that. They provide one-on-one care with patients that are either elderly or disabled or injured. A lot of times they work with pregnant women or new mothers that are nursing at home and need a little bit of help, maybe with breastfeeding. Patients recovering from surgery. Again, they're kind of like a bridge. They kind of transition patients from the hospital, because they're not sick enough to be in the hospital anymore, but they still need a little bit of help once they get home. And home health is great for that. And it's very much you set your own schedule. I think that you're given a certain amount of patients you need to see within a day, and you travel between patients, and you offer the care as obviously offer the care as you go, and they're your patients, so you know exactly what they're probably going to need, and it's not the bedside, and it's not these long hours, and it's I think there's a lot more autonomy. You're a lot more in control of your schedule and of what you're doing. You do have to report to a doctor, I believe. If you run into any number of things, especially if you run into somebody that is not doing well, you might have to have them admitted to the hospital or have them sent to the ER. But again, these are all skills that hopefully you'll acquire before you go into home health, and so you'll be ready when you meet these circumstances. Fifth avenue that I wanted to talk about is public health nursing. Now, public health nursing is very cool because you get to go into the community and kind of like enforce or teach people how to stay healthy, and how to stay out of the hospital. So a lot of like primary care things, immunizations, facilitating like immunizations drives or vaccine drives, or screening services that can catch, something that may be brewing, that, maybe a lot of times people in the community, have not been to the doctor because they don't have insurance or whatever, but they haven't been to the doctor, and they could be festering there with like some undiagnosed high blood pressure that is just going to explode one day. And, a public nurse, a public health nurse could be someone that catches that by doing a screening. And so public health nurses are very, very important too, because they keep our communities healthy, or as healthy as we could, with a lot of education, and catching a lot of things while they're doing screening. So if you like public health, if you want to go out into the community and make a difference in the community, and make sure people are staying healthy, you should definitely consider public health and nursing, because it's a very, very important field. Next one I want to talk about is nurse informatics. This is not a very well-known field, but it's a very, very booming field. Obviously, we use a lot of electronic data acquisition forums in order to do nursing in our hospital. And the informatic nurses are our data experts. So they combine, all of their clinical expertise with all their data expertise, and they really help to kind of like streamline the data that we acquire from the patients. They are the bridge between data and nursing practice. So they are very, very important. Now, you can do this as a bachelor's prepared nurse, but there's also like a whole separate, there's a master's actually that is concentrated on nurse informatics. And so if, data systems and computers and all that technological stuff is your kind of deal, this is definitely a good place to look. They are very well compensated, especially when you get to that master's prepared level, and they're obviously very important. We can't function in healthcare without informatics and without computers and data. So they are very highly sought after. The next one is school nursing. Now, you all, I'm sure, have heard about nurses that work in schools, and that's also actually a really good career path to go down. Obviously very straightforward. You're in the school, you're off on summers just like the teachers, and you deal with injuries that may happen during the school, and especially with the kids that have like chronic conditions that need to be taking medications at a certain time, that they need to have medications in school, and so on and so forth. But it's very straightforward. Obviously very far away from the bedside, very normal hours, off during the summer. I mean, I don't even know why I'm not a school nurse. That actually sounds like a really, really good place to be. But yeah, if that seems interesting to you, you should definitely think about that. One is flight nursing. Now, flight nursing is like the opposite of school nursing, okay? Because if you're going to be a flight nurse, if you're going to be on any kind of aircraft that's going to be carrying a patient from wherever they were found to the hospital, you have to know that this patient is going to be very, very sick. And that's why they are not stable enough to move on the ground. That's why they have to be flown, and because it's much faster. And so, if you love that adrenaline pumping, that, kind of like living on the edge type of thing, and you don't have to be at the bedside, flight nursing is the way to be. You're going to be probably doing some medical procedures. You're going to be assisting, if there's a doctor on the flight, you're going to be assisting the doctor, doing some medical procedures, administering medications, putting them on drips, and just keeping them stable, just keeping them alive until they can get to the hospital. But it's definitely not for the faint of heart. These are very, very sick people. But if that's your thing, that is definitely something to think about also. One is nurse recruiters. Nurse recruiters get forgotten a lot, but they're very important too because they most likely have had some clinical experience and are nurses, obviously, and so they know how to connect with a potential nurse that they want to have hired at the hospital that they work at, and so we want we want good nurses at our hospitals, and so nurse recruiters are very important. Again, not the bedside, clearly semi-normal hours. That is definitely another good career path if you are not into the bedside thing. Next is clinical research nurse. That's one of the ones that I told you guys before that I worked with. You're basically coordinating a research study. The one that I worked with was coordinating a research study that was testing different kinds of leads on pacemakers and defibrillators, and how well they were working, and how the patients were feeling. They were feeling better. The heart failure was getting better. It was very, very fascinating, and that was definitely you definitely need like somebody that has clinical knowledge in order to decipher like the nuances of the study and of the patients also, and so and obviously that's giving us more information on how to make better devices, and so that's definitely, if you're into research and you're into writing up communicating with IRBs and communicating with companies and stuff like that, this is definitely would be a field for you to think about. Now, this next one, I definitely should have probably looked into it, is forensic nursing. I am like the biggest Law and Order fan there is out there, and forensic nurses pretty much work with patients, victims of violent crime, especially rapes and stuff like that. They do rape kits, and they work with law enforcement also in order to gather all the information that they need in order to solve, crimes and any kinds of crimes, especially violent crimes. But they all can also work with the medical examiner or the coroner in order to gather more information to try to solve the issues that they come across. So if that is your thing, that's not everybody's thing. All that blood and gore and violence and all that trauma and stuff can be very triggering to some people. But if that's your thing, that is this forensic nursing is definitely a very, very cool thing to be able to do. You're really, really helping law enforcement and really helping these poor victims, and making sure that cases are solved and that perpetrators are caught. Last one that I have to talk about is nurse writers. I literally didn't even know that such a thing even existed, but just doing a little bit of research, I was like, oh, nurse writer. If you are into, writing and you love to blog, or you love to, you write in your journal every day and stuff like that, this might be something to look into. Nurse writers, they basically sometimes engage in like dialogue. They're patient advocates that engage in dialogue with like the healthcare industry for whatever reason. They're the ones that kind of like facilitate that, or they'll blog about if they're employed by a certain hospital, the hospital will have them blog about whatever topic, or will have them be in charge of the social media aspect of advertising the hospital. Work with web-based magazines by writing healthcare articles, and obviously things that only a nurse can really has the knowledge and the background in order to talk about. And also script educational materials or historical books, or even TV or movie scripts. If you're, if like you love writing and you have a really good imagination, if that's something that you could get into, I'm sure that's probably pretty competitive to get into, but never say never. It could be something that could be really, really fulfilling and really exciting and cool to work for, and not be at the bedside. So that was a pretty exhaustive list. I hope that you're still here after all of that talking, but I hope that this video was helpful. Leave me a comment. Let me know what you think. Let me know if you think of anything else. I'm sure that there's something that I've forgotten or that I didn't talk about. That's also a fabulous way of not being at the bedside but still be able to use your nursing degree. But leave me a comment. Let me know. Please like and comment. I said comment twice. I'm sorry. Please like this video and subscribe. And I will see you all later. We'll talk some more about nursing things that we love. Thank you. Bye.